Well, I have the pleasure of making a few remarks this morning to kick off this day beyond providing awards, but I must say that one of the things that I've enjoyed in my years as commissioner of DHHS has been honoring champions of our work. It was a real privilege today to congratulate Jim for his many years of visionary dedication and tireless service to people with mental health challenges, especially in the pursuit, as he said, of not just work, but full-time employment at that. And there are many other champions in this room today. It's nice to see so many familiar faces. As most of you know, commissioners are appointed to their jobs by the governor, confirmed by the legislature, and then when political powers shift, commissioners leave their jobs. And while Laura, who you all see here, and my experience usually stands us in good stead for future employment, like everyone who's looking for work, there's always a level of uncertainty when looking at what's on the horizon in the job market. If we borrow a jargon from today's TV weather report, for too many Mainers, today's employment forecast is mostly cloudy, with rain or snow likely. Unemployment in October, though down from a year ago, is at 7.7%, meaning that roughly 56,000 Mainers, the highest number ever recorded, are unemployed. And when it comes to persons with disabilities, the people who we're mostly talking about today, the unemployment numbers are staggering. A 2008 study by Cornell University pegged Maine's unemployment rate for persons with disabilities at 61%, which is also the national average. Individuals with disabilities are the largest minority group in the nation and yet have the highest unemployment by far. It's safe to say that all of us in this room are working to see this number drop. As the author of the Americans with Disabilities Act in 2000 wrote on behalf of people who are disabled, and I quote, "Give us the right to be fired," end quote. Though we know that individuals with disabilities don't want to lose their jobs, and many more who don't have jobs now want to work, we do know that they all want fair treatment in the workplace. DHHS, the Department of Labor, and other partners remain diligent in our efforts to break down the barriers to employment that face the people we serve. Like many of the faces I see here today, a significant part of my own career has been centered on employment and the role it plays in wellness and independence. I began as a vocational rehabilitation counselor when my hair was black, working with various populations. While working as a mental health program coordinator, I focused on the development of programs to support work, services, and for 13 years, I had the honor of working with Richard Balser, Ron Welch, Karen Frazier, and the Maine Medical Center staff to develop innovative and best practice approaches to the delivery of employment services. How many in this room remember HIP when it didn't mean cool, but Hospital Industries Program? See, a few of you remember. One of the highlights of my career was being part of the group that forged the first integrated work policy. It was a singular state agency policy, very forward-thinking at the time, and extremely controversial. We aligned our work to the federal RSA policy of requiring a shift to non-sheltered employment. And when you entered the conference today, you had the opportunity to pick up the most recent employment policy for people served by DHHS. I think the principles are pretty much the same as they were back, I'd like to think it was November 15th, 10 years ago. Let's just make it a celebration and pretend. But those principles haven't changed. What we have done in this new policy is extend those principles to every population that DHHS supports. The policy was developed by an employment policy work group, and I would ask that members of this group who are in attendance stand and be recognized.